Hi friends, sleep apnea, how it affects your brain, your eyes and the body. Snoring is not innocent, it damages your organs. Can sleep apnea cause diabetes, hypertension, eye problems? Yes, it can. So let's take a deep dive into sleep, how sleep apnea, what is sleep apnea and how it affects. Let's get into it deeply. So there are three types of apneas. What does apnea means? Apnea means there is no enough oxygen going to the brain and other parts of the body. So during sleep, if it happens, it's called sleep apnea. And if it is because of an obstruction, especially in the visual air pathway, the larynx, if it gets constricted, then you have obstructive sleep apnea. If it is from the brain, because the brain is not sending proper signals to the muscles in the larynx, then it's called the central sleep apnea, central apnea. And it could be a mixed apnea where it has an involvement of the brain and the larynx as well. So then it becomes a mixed apnea. There are three different types. So where all can it cause damage? Obviously, it can cause damage to the brain, it can cause damage to the eyes, heart, kidneys, liver, lungs, and diabetic patients, hypertension. For people who have low vision because of retinitis pigmentosa, macular degeneration, dystrophies, stroke, all these are because of sleep apnea. You would be astonished, right? So sleep apnea is a condition where your breathing stops multiple times during sleep due to airway obstruction. Each episode can last from 10 seconds to even a minute. Just imagine 1 minute, if there is no oxygen going to the brain, you could have devastating complications. Imagine your brain and body being deprived of oxygen 50 to 60 times every hour. This causes poor sleep, daytime tiredness, and more importantly, long-term damage to multiple organs. Eye diseases due to sleep apnea are, as I told you, retinitis pigmentosa, macular degeneration, dystrophies, glaucoma. Normal tension glaucoma is a big entity, and non-arthritic ischemic optic neuropathy. The optic nerve blood supply suddenly gets lost. So it's a sudden painless vision loss. Floppy eyelid syndrome is one thing where it causes dryness, dry eyes, and retinal vein occlusion, to name a few. In fact, patients with sleep apnea have 3 to 6 times higher risk of optic nerve damage. So brain and neurological effects: memory loss, brain fog, poor concentration, mood disorders, anxiety, depression, and increased risk of stroke is definitely there. The neurodegenerative changes and higher risk for dementia, Alzheimer's, Parkinsonism, etc. So chronic oxygen deprivation at night affects brain metabolism, gray matter shrinkage, and worsens neurological health over time. What are the heart and blood vessel conditions? Hypertension, even resistant hypertension occurs. Arrhythmias, especially atrial fibrillation, coronary artery disease, and heart failure, sudden cardiac death, especially at night. You would have seen a lot of people with this, suddenly they went to bed and they didn't wake up. That's because of sleep apnea, my dear friends. It's an independent risk factor for heart attacks and strokes. So it is an independent risk factor. In patients with existing cardiac disease, it worsens the prognosis. So what are the metabolic and systemic side effects? Diabetes, it increases insulin resistance, higher risk of developing type 2 diabetes, worsens sugar control in diabetics. Obesity, it is a bidirectional. Obesity increases obstructive sleep apnea. Obstructive sleep apnea increases weight gain and due to hormonal changes, and increases the obstructive sleep apnea again. So they go through a vicious cycle. So it is very, very dangerous in obese patients. It has to be done. Hypertension, due to sympathetic overactivity, hypertension increases. Poor response to medication. If the sleep apnea is not treated. So both diabetes, hypertension, you can go on treating, but patients won't have a cure. It could be because of sleep. So ensure that you have your sleep apnea test done if you have any of these problems. What are the other organs affected? Kidney, it worsens chronic kidney disease, increases proteinuria, and contributes to hypertension related kidney damage. That is a big finding which they found. Liver, associated fatty liver, NFALD, NAFLD, and abnormal liver enzymes are also noted. Hormonal effects like low testosterone in men and thyroid disorders, some overlap with hypothyroid symptoms. So a lot of people with they have infertility problems. It could be because of this condition. So sleep apnea is a silent killer. Mind you, many patients don't even know they have it. If you snore loudly, feel tired in the morning, or you have uncontrolled diabetes, hypertension, you should get a sleep study done. Sleep apnea can be treated with CPAP and BiPAP machines. Weight loss and certain positional therapies also will help. And we do it at Dr. Sashi Eye Care. This is the testing machine for sleep apnea. We typically have this in our own setup. Patient can come in and lie down, take a test. You have to just tie it on the chest and have a nozzle here where oxygen comes in, and a pulse oximeter which will check your heart rate, your how the brain is functioning, and overall how much of air is going in, coming out, desaturation levels, saturation levels, everything will be recorded in this. So it is very important for the eye, brain, and other organs. That's why we are doing it our own center. Otherwise, if you don't want to stay in the hospital premises, we can get this to your home, and at your own bed, you can do this test. So the take-home message is sleep apnea is no more just snoring. It silently damages your eyes, brain, heart, kidneys, and other metabolic functions. Most importantly, in the eye, people with retinitis pigmentosa, macular degeneration, dystrophies, even stroke in the eye can come because of this. It's fully treatable with either CPAP or BiPAP therapy. Improves the lifespan and quality of life. If you are someone who you really have somebody who has this problem, or you know of somebody, please ask them to get this tested today. Because at Dr. Sashi Eye Care, we not only treat the eyes, we treat the entire brain, the eye, and the body wholesomely. And we are into wellness more than creating illness and then treating it. If you found this useful, please share it with your friends and family. Like and subscribe for more videos on integrated health, eye care, and wellness. Dr. Sashi again. Thank you.